Good evening. Welcome to Hand Hygiene Update in Dentistry. I said good evening, but looking from the attendance list, we have participants from all over the world, from Qatar, the United States, South America, European nations, wherever you might be. Welcome and thank you for attending. It's an honor to be here. Before we begin, I'd like to share a couple quick housekeeping morsels of information, and that is, number one, I plan to speak for about 45 to 50 minutes, and after that time there will be time for questions and answers, and the website will lead you to a 5-question questionnaire in order for you to receive your continuing education credits for this course. You will be awarded 1 hour of CE credits after the completion of the small little quiz at the end of this presentation. The quiz is pretty simple. Please don't fret about it. If you listen to the presentation, you will do just fine. Let's go on. First, I would like to thank Air Techniques for sponsoring this presentation, and a little bit more about me. I'm a key opinion leader with Hugh Freedy, a consultant with SciCan, and I'm an educational consultant for OSAP. OSAP stands for Organization for Safety, Asepsis, and Prevention, and this is an infection control organization dedicated exclusively to dentistry. It's the only one in the United States and probably the only one in the world. And even though I am an educational consultant with OSAP, the findings in this presentation are not necessarily consistent with those of OSAP. Now, I know you read the course objectives. This was on the list with my course description, but in this course, I will explain the relationship between hand hygiene and the spread of infection, the various techniques of hand hygiene, including alcohol hand sanitizers, and I will discuss product considerations that can enhance compliance. And I will also identify appropriate methods of motivation and monitoring of hand hygiene. Before we begin, I'd like to share with you a gentleman named Ignaz Semmelweis. He is the first to institute a hand washing program in the mid-1800s. I read a book about him, and you will see the book located at the lower portion of the screen as my reference, The Doctor's Plague, Germs, Childbed Fever, and the Strange Story of Ignaz Semmelweis, published in 2003. He was a Hungarian physician who lived in the mid-1800s, and he is the first to document the positive effects of a hand hygiene or hand washing program. He discovered that the incidence of this disease called puerperal fever, which is childbed fever, could be drastically cut by the use of hand disinfection in maternity wards or OB clinics. At the time, mortality of childbed fever ranged from 10% to 35%. Sometimes during outbreaks, it was even higher than that. Just so you know what childbed fever was, the women who had this shortly after giving birth would experience a distended abdomen, severe pain in their lower abdomen areas, and death within several days of delivery. It is now known that a group A hemolytic streptococcus is responsible for most cases of puerperal fever, but at the time, nobody really knew what the cause was. Now, at the hospital where Dr. Semmelweis worked, there were 2 main clinics, the first clinic and the second clinic. And just so you know, you did not want to give birth in the first clinic. At the first clinic, treatment was provided by both medical students and physicians, and these medical personnel rotated between performing autopsies and going back to examine their laboring mothers. And of course, they did not wash their hands in between, and of course, gloves were not in existence at that time. The second clinic, the treatment was provided by midwives, and the death rate was much lower. It averaged around 2.03%, whereas the death rate in the first clinic, where you did not want to give birth, ranged from 13% to upwards of 35%. So this was not good. This was not good. So Semmelweis set out to discover and figure out why the discrepancy and what the differences were. So at the time also you need to be aware that wealthy people did not give birth in hospitals. Wealthy people gave birth in homes by a midwife, and only the underprivileged prostitutes, unwed mothers received health care in hospitals in return for free care. So at the time they didn't know what caused this childbed fever, and it was thought that foul air or a putrid atmosphere or perhaps tight corsets or petticoats or a personal disposition predisposed these laboring mothers to have this condition. Nobody knew where it came from. So Semmelweis was still not sure where it came from, but he suspected that the cadavers and infectious particles on the hands of physicians and medical students had something to do with infecting the laboring mothers. Of course, he did not know this, and it was never proved. However, after implementing his hand hygiene program, the mortality rates decreased dramatically to less than 2% on the first year. So it was indeed effective. So you would think he would have been a hero and everybody would have been praising Ignaz Semmelweis's name. However, his ideas were rejected by the medical community. Unfortunately, he did not publish his work or demonstrate his research or share his findings in any medical communities, and he became quite bombastic and committed to his cause. And as a result of that, I'll get more into his personality and his disposition in a moment, but eventually he was committed to an insane asylum where he died at the age of 47 after beaten by guards 14 days after being committed. And it was believed that he died of sepsis, which is, of course, the very same condition that he set out to discover and implement his hand hygiene program as a result of. So that was quite ironic. So there's a couple more names in the early infection control world that we need to be aware of. Oliver Wendell Holmes is one of them. He wrote a paper on the cause of childbed fever and how it is indeed contagious. And he did say unclean hands on the hands of physicians and medical students was responsible for the cross-contamination between the cadavers and the laboring woman. The hand hygiene theory then accepted widespread acceptance after he died many, many years later. A couple more important men on the scene were Robert Koch, and he's known for developing Koch's postulates for demonstrating that a disease was caused by a particular microorganism. And then Joseph Lister was instrumental in developing applications of the germ theory with regard to sanitation in medical settings and aseptic surgical techniques. So those are a couple more names. But Oliver Wendell Holmes is primarily the one responsible for crediting Semmelweis with his hand hygiene effectiveness. So let's look at hand hygiene then and now. What did we know then and what do we know now? In 1850, nobody knew of a germ theory. It was suspected where people had all kinds of theories where infections came from, but nobody really knew. Here we are in 2016, and of course we know the germ theory that germs are cause diseases, and specific microscopic organisms are the cause of specific diseases. The compliance rate back in 1850 was very, very low, almost nil, and now, unfortunately, in 2016, our compliance rate still is a little bit less than 50%. That means you can go to any healthcare provider, flip a coin, and there's a 50-50 chance that he or she will wash his or her hands before treating you. And it's still pretty sad considering what we know about the effectiveness of hand hygiene. Now, products used for hand antisepsis back then was chlorinated lime solution, and that's basically chlorine solution that you would find in a swimming pool, and as you might imagine, it was pretty darn caustic and irritating to hands. Now in 2016, we have numerous products available for hand hygiene, many products specifically for medical and dental personnel, and hand care products also recommended for hand hygiene as well. Now, hand hygiene is the most important measure to prevent disease transmission in any healthcare setting, and this has been proven over and over again. There are at least 2 million healthcare-associated infections per year, and about 90,000 of these patients die as a result of these infections. And effective hand hygiene combined with wearing of gloves are an essential component of infection control, and hand hygiene, of course, is part of standard precautions. Now, 20 to 40% of the infections, healthcare-acquired infections, are a result of cross-contamination from the hands of healthcare workers, and hand hygiene remains the most important method of reducing risk of cross-contamination. Your hands can pick up microorganisms by touching contaminated people or contaminated objects, medical or dental equipment, or contaminated surfaces, or your own bodily fluids, coughing into your hands or wiping your nose. These are all methods of cross-contamination in ways that your hands pick up microorganisms. So in the guidelines for hand hygiene in the dental setting, we have 3 main documents that you should be aware of that have been given to us by the CDC, or Centers for Disease Control in the United States. Even though this is a U.S. institution, it's recognized worldwide, of course, along with the World Health Organization and some others as well. So, Guideline for Hand Hygiene in Healthcare Settings came out in 2002. This is a CDC document, and this document will tell you anything and everything you would like to know about hand hygiene. Now, getting specifically into dentistry, our guidelines for infection control in the dental healthcare setting were given to us in 2003. There's a large section in this document about hand hygiene as well. Recently, a couple of months ago, CDC came out with a new document for the dental profession called Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care. This document is just that, a complete summary of the existing guidelines that were given to us in 2003. It gives us the nuts and bolts, the bottom line expectations for safe care, what we need to know, the nuts and bolts of it. It does not go into great detail. It does not provide the science behind the recommendations, and it doesn't give specific recommendations, but it gives generally the basics, the nutshell version. Now, in addition to this, morsel of information came across my desk today, and that is a new book will be published in December 2016 called Hand Hygiene, a Handbook for Medical Professionals. And it is published by Dr. Pittet, Dr. Boyce, and Granzi, all of 3 whom are physicians, and it's going to be known as the first comprehensive authoritative review of the most fundamental and important issues in infection control, patient safety, which is, of course, hand hygiene. It's going to offer guidance for the individual institutions, organizational level for national and worldwide hand hygiene promotion campaigns. So be on the lookout for this as well. I'm excited for the publication of this, and it's the first of its kind. Look for it December 2016. Now, when it comes to hand hygiene, we need to be aware of 2 types of microorganisms on our hands. The first is the transient flora. The second is resident flora. And I'm going to turn on my cursor here so you can see what I'm seeing. Transient flora is on the outer surface or the outer layers of your skin. The germs or microorganisms on this layer of the skin are acquired by contact with patients or contaminated items, like I mentioned. These are most likely to cause infections, and they are most easily removed with hand washing and deactivated with alcohol hand sanitizers. The resident flora, however, lie in the deeper layers of the skin, and these are least likely to cause infections and most difficult to remove. When we clean our hands, we are trying to eliminate the transient flora and reduce the resident flora. It's unrealistic, and we don't want to eliminate the resident flora. We want to eliminate transient flora. So I'm going to turn off my cursor and go on to the next slide. There are a couple little definitions that I need you to be aware of before we continue. One is hand hygiene, and this is just a general term. This includes hand washing, using an alcohol hand sanitizer, or using an antimicrobial hand wash, and also surgical hand antisepsis. Hand washing, on the other hand, means exclusively washing your hands with soap and water, plain soap. An antiseptic hand wash is washing your hands and using a soap with an antibacterial soap. Moving on. An alcohol-based hand rub is a waterless hand rub. It's an agent that contains 60 to 95% alcohol. And surgical hand hygiene antisepsis is washing using plain soap and water, and going back and using an alcohol hand sanitizer before operations by surgical personnel. And once again, the purpose of this is to eliminate the transient hand flora and reduce the resident flora. Now, this information comes from the CDC document, the Summary for Basic Expectations for Care, that I mentioned several slides ago. And like I said, this is a synopsis or a summary of what we need to be aware of. So key recommendations for hand hygiene in the dental setting. For non-surgical procedures, and these are procedures for operative dentistry, performing examinations, hygiene procedures, you may perform hand hygiene when hands are visibly soiled. You must wash your hands. When your hands are visibly soiled, you must wash. And after you touch contaminated instruments, equipment, surfaces, or anything that's likely to be contaminated with blood or any type of bodily fluids, you must wash. Before and after treating each patient, you must perform hand hygiene. Before putting on gloves and immediately after glove removal, you must perform hand hygiene. If your hands are visibly soiled, you absolutely must wash because an alcohol hand sanitizer may not be used. An alcohol hand sanitizer will not remove existing microorganisms. It will denature the proteins in microorganisms on your hand, but it will physically not remove them. So let me review this a little bit. When your hands are visibly soiled, you must wash. If you've bare touched anything that may be contaminated, or you've got visible blood or saliva or secretions on your hand, you must wash. Before and after treating each patient, you can either wash or use alcohol hand sanitizers. Before glove donning or removal, you must perform hand hygiene, and it can be either alcohol-based hand sanitizer or washing. And when your hands are visibly soiled or after you've performed any bodily functions, scratching your nose, scratching your ear, blowing your nose, coughing into your hands, you must use soap and water as well. So this is a synopsis of what I just mentioned on the previous slide. At the beginning of the workday, you must thoroughly wash your hands, and it is recommended that at this point you wash your hands for 1 solid minute. Before gloving, wash your alcohol hand rub. After glove removal, wash your alcohol hand rub. When hands are visibly soiled, wash only. Before and after eating, wash only. Personal functions, wash only. And if there's one slide I want you to remember from this whole slide deck, this is it. Now let's talk about techniques for hand hygiene for non-surgical procedure. Like I mentioned, non-surgical procedures are just general operative dentistry and hygiene procedures, etc. So first, get your hands all wet, and that seems common sense, but moisten your hands all the way up to your wrists. Apply enough soap that's recommended by the manufacturer, and enough soap that it can cover all surfaces of your hands. Now, keep in mind, manufacturers may tell you exactly how much product they want you to use. For instance, one specific product says, if it's a foam-based product, and it says on the manufacturer's instructions, for general dental procedures, use the quantity the size of a ping pong ball. For surgical procedures, use the quantity the size of a tennis ball. So you can see you have a larger quantity and more product for a surgical procedure. So look at your manufacturer's instructions. They may not all say the same thing. So lather and wash well for at least 15 seconds, 15 to 20 seconds ideally. If your hands are washed for 5 to 10 seconds, that's not cutting it. That does not allow enough time for the product to get into all surfaces and for the hand hygiene agent to do its work. So at least 15 seconds, 15 to 20 seconds ideally. Clean between your fingers, around your nails, underneath your fingernails, and the backs of your hands. And I say these things specifically because these are the areas that are most commonly missed. After you've washed your hands, rinse well under soaking water. Keep your hands low in the sink so you're not splashing around everywhere. Dry your hands completely with a disposable paper towel. Notice that I say completely. If your hands are a little bit moist when you put on your gloves, that can lead to a little bit of contact dermatitis, and you don't want that. We'll address irritation, contact dermatitis in just a moment. But dry your hands completely with a disposable towel. Then use that paper towel to turn off your faucet so you're not recontaminating your hands or your surfaces. So now we'll move on to an alcohol-based hand rub. And this may seem common sense, but once again, we need to go through specific instructions for medical or dental personnel. Once again, dispense the amount of product as specified by the manufacturer. Rub backwards and forwards with clasped fingers in your palm, and the purpose of this is to work that material into your fingernails and fingernail beds. Work hand rub underneath your nails and into your cuticles. Moving on, put your hands palm to palm and rub the product in up to your wrists. Then go palm to the back of the hand, interlace between your fingers, and once again this works the product in between your fingers, another area that's very commonly missed. And swish your hands so it's right over left, then left over right, to repeat it for both hands, both sides. Now you're palm to palm with fingers interlaced and tops of fingers to palms with fingers interlocked. The purpose of this is to focus on every single surface of your hand and not miss any parts. And don't forget your thumbs. Rub your thumb clasped in the palm and switch your hands, repeat. And once again, you need to use enough product to keep your hands moist for at least 15 seconds before the alcohol hand sanitizer evaporates. When your hands are dry, then it should be okay to go ahead and glove up. Now, if you're performing a surgical procedure, hand hygiene protocol is a little bit different. Surgical procedures would be performing biopsies, periodontal surgery, surgical extractions, implant placement, anything of the sort that's an invasive procedure is a surgical procedure in which you should perform surgical hand hygiene. To perform this procedure, before you put on sterile surgeon gloves, you have two options. Number one, scrub your hands with an antimicrobial soap with persistent activity and follow the manufacturer's instructions for the time. This is generally 2 to 6 minutes. And then the second, wash your hands with plain soap and water. The second option would be to wash your hands with plain soap and water, and then follow up with an application of alcohol-based hand sanitizer with persistent activity. Now, before I go on, I have a couple questions here. And let me see if I can go to Q&A mode. Oh, Matthew says, I've always heard you need to sing the happy birthday song. That's funny that you asked that, Matt, because I did teach in a dental assisting school, and we did teach the students to sing happy birthday to you. If you sang happy birthday to you twice through, that's approximately 20 seconds. And fortunately for you, I will not demonstrate that. Deborah says that we have terrible feedback, and I will have to contact my tech support to help out with that. Oh, I'm so sorry about that. And sounds. I can hear you, and the slides are not changing. Unfortunately, I can't help with tech support. So let me get out of this. And now I have several questions to ask you. And here we have our first poll. Our first poll is this: which hand hygiene method is most effective at killing bacteria? And let me see if I can conduct my poll. Okay. Which hand hygiene method is most effective at killing bacteria? Our choices are soap and water or alcohol hand sanitizer. And I'll let you go ahead and vote right now, and you can see the results live as folks are voting. And by soap and water, I just mean plain soap or even antibacterial soap. Which is the best at killing bacteria? I'll give this 2 more seconds before I close this poll. It looks like the general consensus is that soap and water is the most effective method at killing bacteria. Unfortunately, that's incorrect. Alcohol-based hand rubs are the most effective at killing bacteria. They denature the proteins in bacteria in your hands and are the best at killing bacteria. Of course, soap and water is more effective at removing any type of more microorganisms or debris on your hands, but at killing the bacteria, it's alcohol-based hand rub. Okay, now I need to figure out how to get back to my slides. Hit return to slide. There we go. Okay, now we are on to our next question. And once again, I'll put this into a poll, poll number 2. The question is, which hand hygiene method is less damaging to your skin? Would it be soap and water, or would it be alcohol-based hand rub? And I'll go ahead and share this with you. And I'm hoping that I would like to share this with the audience, and I don't quite know how. I'm hoping that you can see the responses. Okay. Gotcha. After I'm done with the poll, I'm going to hit show and show you the results. Okay, so which hand hygiene method is less damaging to your skin? Soap and water or alcohol-based hand rub? And I will close the poll and show you the results. And the audience says soap and water is less damaging to your skin. And the correct answer is alcohol-based hand rubs are less damaging to your skin. When you wash your hands with soap and water, you are actually removing and damaging, causing a little bit of damage and removing the outer layer of protected lipids on your epidermis of your hands. Whereas when you use alcohol-based hand sanitizers, you are removing those lipids and then rubbing them back into your hands. And that maintains the integrity of your epidermis. Also, alcohol-based hand rubs typically have an emollient in them and materials to soften your skin as you're using them. So alcohol hand sanitizers are less damaging to your skin. Okay, moving on. My next question, what's the ideal temperature for hand washing? And once again, I have another poll. Bear with me, I have this poll and one more to go. So, which is the ideal temperature for hand washing? Hot water, cold water, or tepid or lukewarm water? Lukewarm water would be what you would put into a baby's bottle. Not too hot, not too cold, but just right. So I'll give you folks a couple minutes to conduct this poll. And when I grew up, I know my mom taught me hot water because it kills the most germs on your hands as possible. But let's see what the audience has to say. Okay, it looks like most of the audience says 95% of the votes, or I'm sorry, 82% of the votes say tepid water or lukewarm water, and that is indeed correct. You do not want to use hot water or very cold water because temperature extremes will enhance contact dermatitis and irritation on your hands. Hot water will open the pores and allow chemicals to seep on in, and cold water will cause irritation. So you want to use lukewarm water if at all possible. And I have one more question for you. May gloves be substituted for hand hygiene? Let's conduct this poll. And this is my last one, so bear with me. We'll start the poll. Can you use gloves instead of hand hygiene? Yes or no? I am so glad to see 0 votes for this. Oh, I see 1. But 98% of you so far say no, you cannot. So just because you are, well, let me have you vote for a couple more seconds before I show you the results. Okay, I'm closing the poll and we'll show the results. 97% of you say no, it is not a substitute for hand hygiene, and a few of you say yes, it is. Well, just because you pull a fresh pair of gloves out of the box, you still need to perform hand hygiene. If you think about it, I'm going to go into draw mode. I'm sorry, show cursor. Underneath these gloves, you might imagine it is warm, it is moist, and your hands are in there for maybe up to 45 minutes to an hour at a time. And you can imagine it's the perfect environment for microorganisms to multiply, grow, and divide. And so when you take your gloves off, you still have some contaminants on your hands. Plus, keep in mind that gloves are not fail-safe. There are small little microporosities that allow microorganisms to be transferred back and forth. So your hands are not perfectly clean underneath. You still need to wash your hands before and after you perform, before you're gloving. So moving on. Let's talk about adverse effects from frequent hand hygiene. Like I mentioned earlier, I was a clinical instructor at a dental assisting program, and I counted the number of times I performed hand hygiene during clinical work days. Some days it got up to 80 or 90 times. So you can imagine if you're washing your hands 80 to 90 times per day, you really can have adverse effects of overdoing it. Fortunately, companies and manufacturers of our skincare products for hand hygiene know that we are washing our hands so many times during the day, and they take that into consideration. As a result, they can put in emollients or products to soften our skin and prevent irritant contact dermatitis. And I'm sure we've all had this at some time or another if we've practiced dentistry a long time. The symptoms are dry, irritated, itching, cracking, and sometimes even bleeding skin caused by certain antiseptic agents or by inserting wet or damp hands into our gloves. So if we have contact dermatitis, it can lead to some of the barrier protection of our skin. Now, allergic contact dermatitis is an entirely different game. Allergic contact dermatitis looks the same as irritant contact dermatitis, but this is indeed an allergy. The most common cause of this is due to fragrances or preservatives and sometimes latex in our gloves. Fortunately, most offices are staying away from latex and utilizing nitrile-type gloves or synthetics at this time. So watch the fragrances and the preservatives, and if you do have contact dermatitis, go back to a plain soap for a while until your hands clean up, and be sure to utilize lots of lotions. And we'll talk more about this in a second. There are respiratory allergies too. I'm sure we've all had patients in the dental chair who have worn too much cologne or too much perfume, and we or our patients can get coughing and sneezing as a result of that. And that's the primary reason why we are discouraged from wearing colognes or any type of scents in the dental operatory. Now, this hand on the right, this is my dental hygienist, and one day last winter she came to me and said, my hands are killing me. What am I going to do? And of course she had irritant contact dermatitis. Her hands were chapped and cracked and painful. She did not want to wash and dry thoroughly and put on her gloves because it just plain hurt. So in this situation, I had her utilize a plain soap and water, medical grade of course, wash thoroughly, dry thoroughly, so she would remove any residual chemicals on her hands, and put dry hands into her gloves, and utilize lots of lotions or skin repair creams in between usage, and that did clear her on up. So keep in mind all of these techniques if and when this should happen to you. Once again, ensure that your hands are completely dry before putting on gloves, no matter what product that you use, whether it be an alcohol-based hand rub or any type of soap and water. Now, hand lotion, it's recommended to use only hospital-approved hand lotions. Many staff members, and mine included, like to bring their fancy schmancy products from home that smell a little bit better and feel a little bit better to them. And that's not a good idea. That's not a good idea for several reasons. Number one, we don't know what that product is based with. Over-the-counter products often will have a mineral oil or petroleum base to them, and that can interfere with the integrity of your gloves and cause little microporosities in your gloves. Hand lotions that are approved for hospitals or medical grade, or I should say dental grade, are water-based, and they are completely compatible with our glove usage. So only use hospital-grade lotions or hospital-approved hand hygiene products completely. And these lotions will increase your skin hydration, replace the depleted lipids that I discussed earlier, and help maintain the barrier function of your skin. Remember, your skin is your first line of defense in any disease transmission, to prevent any disease transmission. Lotions will treat contact dermatitis and hopefully potentially enhance any hand hygiene compliance. Now, this is a quote from the CDC about product considerations, and it says, more widespread use of hand hygiene products that improve adherence to recommended hand hygiene practices will promote patient safety and prevent infections. So what does that mean? What that means is if you're like it, you're more likely to use it, If you hate the product, it's more likely to sit on the countertop. As a result, I encourage staff members to be involved in product selection so that they are more likely to enhance compliance. So product selection, we talked about selecting medical grade products. We talked about medical grade lotions, but let's talk about medical grade alcohol hand sanitizers or soaps as well. Now, you should not be going to the local pharmacy or grocery store and picking up a household grade product and bringing it into your operatory, whether it be a soap, sanitizer, or a lotion. FDA approval for these products is entirely different than medical grade products. For instance, if you select a medical grade product and you read the label claim and it says this product kills 99.99% of bacteria in X amount of time, by George, it's going to do just that. If you select a product, an over-the-counter product that has the same claim, it may or may not, we don't know. The FDA jurisdiction for over-the-counter products is entirely different from that for medical products. Then we also talked about the emollients and the skin softening components added to medical grade products. Now, if we use medical grade products, we talked about compatibility with gloves and other hand hygiene products. We already talked about fragrances, allergies, and also some lotions can leave you with a little bit of a greasy feel, and that's not too pleasant for a medical personnel or who are trying to put gloves onto hands that have a little bit of residue on that. And we also talked about products that are acceptable to dental health care personnel. Now, let's go back to Semmelweis because I find him so darn interesting. Back in 1850, there were reasons for noncompliance, and my favorite one is the top bullet point that says, a physician is a gentleman and a gentleman's hands are clean, by George. And you can see this physician on the right. This is Dr. John Snow, not Semmelweis, and you can, but he also had a role in infection control. I won't go into that story today, but I share with you this picture because he was a physician, and you can see the stern look on the face and the proper overcoat and the bow tie and the stern expression. And he would be indignant that you would even insinuate that his hands would be dirty, whether he was working on cadavers or not. So that was insulting. They were offended. They were offended at the notion that they should wash their hands. And of course, the supplies and equipment was not available. Operatories and medical rooms and ORs were not equipped with sinks at the time. And the most important bullet point was that there was no scientific evidence that hand hygiene was effective at all. We had no idea about the germ theory, and it was all just postulated. So let's move ahead to 2016. We have reasons for noncompliance today, and these were given to us originally from CDC, but also in Practical Infection Control in Dentistry by Molinari and Hart. And the reasons stated for, these are self-stated reasons for noncompliance, and you can read the bullet points for yourself, that lack of awareness of principles, understanding, not enough time, hand washing agents cause skin irritation and drying of hands, inconvenient location, lack of sinks, lack of soap, paper towel, wearing gloves may be a substitute, hands don't look dirty, and we don't perceive that there's a risk of cross-infection. Of course, in dentistry, the risk is lower than in medicine. There are more cases studied in medicine than in dentistry, but the same principles hold true that there is a risk of cross-infection with contaminated hands. So let's move back to Semmelweis in 1850 and talk about how he enforced compliance. And I think you're going to get the clue about the Semmelweis guy by reading these bullet points. He had proposed constant surveillance and suspicion of all medical personnel, and if facing opposition by his medical personnel, he became defensive, bombastic, and self-righteous, and a little bit verbally abusive. He would mercilessly expose his adversaries, direct insults toward men for whom rejected his doctrine, become explosive with sarcasm, and here's my favorite, the bottom bullet point, declare before God and the world that you are a murderer. And these are exact quotes by the historian who wrote this book. And as I read these, I thought, probably not very effective. And as you can see, people really didn't like him, and I can say with most certainty I wouldn't want to work for him. So his method of enhancing compliance was not effective. Let's move on. We're moving on to 2016, and I am moving on into a chocolate factory, not a dental operatory. Last summer, or this summer, I went to a chocolate factory for a tour, and outside the food production area, I saw this on the left-hand side, a poster on hand hygiene, why it's important to clean your hands, how you're supposed to clean your hands, when you're supposed to clean your hands. You can see a sink, you can see paper towel, you can see the wastebasket that's hands-free, you can see gloves. Any product that you would need whatsoever is right there and conveniently located. And note the cheerful colors, and it's just warm and welcoming, and everything is open for you. Now, entering the food production area, you can see this poster on the right that says, "Stop. Beyond this point, this must happen, this must happen, this must happen. Remove jewelry, wash your hands, etc., etc., etc." Now keep in mind this is a food preparation, the food industry, not medical or dental, but the same principles hold true. Also at this facility was a gentleman, his name tag said guest relations, but it became apparent after a little bit that his true role was hand hygiene enforcer. He watched everybody wash their hands, and those steel doors stayed shut until he was sure everybody had done a good job. He complimented folks who did a great job and provided advice and encouragement and a little bit of know-how for those who did not do a good job. So I looked at this whole scenario and I thought, there are definitely lessons to be learned about hand hygiene compliance from a chocolate factory that we can utilize in the dental setting. Obviously, we can't afford to pay for or employ a hand hygiene enforcer for each of our offices. It's just not in the budget, but other lessons can be learned as well. Let's look at some of those. Some strategies to enhance compliance nowadays are administrative leadership. If we have a leadership that promotes hand hygiene and sets an example for hand hygiene, staff members are more likely to do the same. I'll share a quick story at this point about visiting a hospital with my dad, who I suspected had a MRSA lesion on his leg. We were being treated by, my dad was being treated by the department head of emergency medicine at a local hospital, and this physician, without utilizing hand hygiene and no gloves, touched my dad's open wound. And I was just appalled watching his every move. And I thought, if he is doing this in front of patients or just out of the blue, what kind of example is he setting for his nursing staff, his lab techs, and anybody else who may or may not enter the medical scene? He's not. So we don't have much administrative leadership or example there. Now, we also can emphasize the use of alcohol hand rubs, product availability and accessibility, encourage the buddy system, look over each other, allow each other to say in a culture of safety, boy, let's step it up a notch with the hand hygiene without taking offense or rolling eyes or getting angry or defensive with each other. There are promotional items that can be distributed, screensavers that say wash your hands. I like the idea of including clinical personnel in product selection. Once again, if they like the product, they're more likely to use it. And there's an education, ongoing discussion, education like webinars today, thank you for attending this one, ongoing discussion. Once you teach somebody to wash your hands, it's doubtful that they will continue that practice for the duration of their clinical career. It requires ongoing discussion, reminders, encouragement, etc. Facility-provided hand lotions, performance feedback, and employee involvement. I read a recent study about hand hygiene compliance and which of these was the most effective, and the correct answer was all of the above. That if you utilize one of these strategies by itself, it's probably not going to work, but if you bundle up several of these together and include your staff in on it, you're probably going to have much more success and higher compliance rate. So look at this list and see what you can do in your own clinical setting to encourage and promote hand hygiene compliance. Now, this was taken from the CDC document, the summary, and this is about hand hygiene, and once again, this is a self-assessment checklist, or you can assess other staff members about hand hygiene. And this came right from the summary document, and it says that the supplies are necessary if surgical procedures are performed. Are you utilizing an alcohol hand scrub? Are staff washing their hands at the appropriate times, etc.? And here are some more direct observations that can be assessed. And once again, this is taken right from the summary document. And I already touched on each of these points, so I won't belabor this slide. Okay, here's a good question. Which hands would you prefer to be working in your mouth, left side or right side? And there's lots to be learned from these pictures. The CDC recommends short, rounded nails without sharp edges, clean nail beds, and no artificial fingernails, no long nails, and of course no hand jewelry. On the right you can see everything has gone wrong, and I don't think I would want these hands in my mouth. Studies have shown that artificial fingernails can harbor much more gram-negative bacteria than short, unpolished nails. So in a general dental setting, it's highly, highly discouraged, and in a surgical setting, artificial nails are prohibited. And if you must polish your nails, keep them short, freshly polished with no chips. Chips can promote harboring of bacteria as well, and minimal to no hand jewelry. In surgical settings, hand jewelry is prohibited, and in general dental settings, it's highly discouraged. I know in all educational settings, including this my assisting program that I was a clinical instructor, we did not allow any hand jewelry at all. So here are some resources for you, and I shared the first three in general, the CDC documents, the hand hygiene document, infection control in dental healthcare settings, and the summary document. And here's a picture of the summary on the right-hand side of the screen. Also, I want you to be aware of OSAP, osap.org. This is the infection control organization that's dedicated exclusively to dentistry, and they have a full hand hygiene toolkit on their website. I encourage you to take a peek, and it provides many links to hand hygiene information, what the World Health Organization says, what the CDC says, product selection, usage, current updates, etc. So that's a great resource for you as well. Know that Infection Control Awareness Month in dentistry is in September 2016, which is right around the corner. The purpose of Dental Infection Control Awareness Month is to get patients to talk about anything infection control related to dental health care personnel and vice versa. Patients are often too shy or timid to ask what's being done to keep them safe under your care, and dental personnel are often too busy or may not take the time to stop and say, I'm doing this just for you. And hand hygiene, hand washing is one of those things. So my technique in my operatory would be to utilize alcohol hand sanitizers and rub it into my hands as I'm talking to the patient and greeting them for the first time. that first appointment. For the first part of their appointment. If they're a new patient, my protocol is a little bit different. And hand washing, I like to perform it in front of the patient so they know it has been accomplished. And if I haven't, I explain why and where it has been performed. Now, this is my final slide with Semmelweis, and it has a quote, "When I look back upon the past, I can only dispel the sadness which falls upon me by gazing into that happy future when the infection will be banished. The conviction that such a time must inevitably sooner or later arrive will cheer my dying hour." And I like that quote. It's a little bit wordy, but I really like it. And I also would like to share with you a small little vignette about the author. At the end of his studies, he went over to Hungary to see the hospital where Semmelweis worked, and he toured through the hospital. It still exists and it's still working. And he found a couple of residents, and he said, "Is this the hall where Semmelweis was?" And they looked at him with clueless eyes, and he said, Semmelweis, hand washing, hand hygiene, a great physician in the mid-1800s. And they still had blank eyes and they were clueless. And at that point, they said, "Well, let me take you down the hall and we'll find an older doctor who might know what you're talking about." So they were clueless. And I wonder, boy, would Semmelweis be offended and appalled that there was no plaque or awareness of his of what he accomplished at that period of time? And I don't think so. What I think is that he would be more pleased if he walked through that hospital and saw medical and personnel washing their hands before and after each patient. That would have pleased him in general. So, Global Hand Washing Day is October 15, and this is promoted by the World Health Organization. And this is my final slide. This is my little buddy across the street who says, "Yeah, Aunt Marie, I washed my hands." See? So with that, this is my final slide for today. And at this point, I will open it up to questions. And I will let you proceed to your 5-question questionnaire and receive your continuing education at this point.